Okay, hi, my name is Jennifer Alston, and I am a BSN student at Athens State University. Before we get started, I want to make you aware that you are being recorded. The purpose of this is a health education program on obesity in middle-aged adults, which is ages 40 through 60. Here is a handout of some things that we're going to go over in the presentation. Okay, the main goal of this presentation is to reduce the prevalence of obesity in middle-aged adults within the community by promoting healthier eating habits and increasing physical activity. Just a little run through about obesity. Obesity results from a combination of factors, including poor diet, lack of physical activity. Obesity is linked to an increased risk of cardiovascular disease and diabetes and can affect the population overall health. The first objective in this program is by the end of the program, you will be able to list at least two benefits of physical activity for weight management. You will participate. You will demonstrate how to look for healthy, low-calorie meals by searching the website provided in the session. And 80% will feel motivated to engage in at least 8 minutes of physical activity daily, and that you will have set goals for weight loss or increased physical activity to be tracked over the next month. Okay, so let's just talk about obesity and its risks for a moment. Obesity is a medical condition characterized by an excessive accumulation of body fat, typically defined by a body mass index of 30 or higher. It is a complex health issue resulting from a combination of genetic, behavioral, and environmental factors. Causes, genetic factors. It can influence how the body processes food into energy and how fat is stored. Behavior factors is poor diet, lack of physical activity, which is going to be our main focus of this program. Environmental factors, unhealthy food, lack of safe places for physical activity, and social economic factors can also play a role. The health risks associated with obesity is cardiovascular disease, which increases the risk of heart disease, which is hypertension and stroke due to the strain excess weight places on the heart and blood vessels. Also, type 2 diabetes, excess body fat, particularly around the abdomen, can lead to insulin resistance. Certain cancers, including breast, colon, and endometrial, respiratory issues as sleep apnea, and other respiratory problems due to the extra weight on the chest and abdomen. Joint problems, it can lead to osteoarthritis, particularly in weight bearing joints like the knees and hips. And then mental health is associated with a higher rates of depression, anxiety, and other mental health issues. So, prevention and measure and management of obesity. First thing we're going to talk about is healthy eating. A balanced diet rich in fruits, vegetables, whole grain, and lean proteins can help maintain a healthy weight. On your handout that I gave you is a food tray from the myplate.com. It tells you when you eat what your plate is supposed to look like and how much you're supposed to have of each thing on your plate. There's also a website on your handout that gives you more information on that. And then regular physical activity, engaging in at least 150 minutes of moderate intensity or 75 minutes of high intensity exercise per week is recommended. Um, so to address the issues of obesity, lifestyle changes we're going to focus on physical activity and healthy eating. Physical activity, increased caloric expenditures. Engaging in regular physical activity helps burn calories, which can prevent excess weight gain and help in weight loss. Activities such as walking, running, cycling, swimming are effective in increasing energy. Improved metabolic health. Exercise improves metabolic health by enhancing insulin sensitivity, reducing blood pressure, and improving cholesterol levels. This can help prevent obesity-related conditions such as type 2 diabetes and cardiovascular diseases, which was mentioned earlier, and muscle mass and basal metabolic rate. Regular physical activity, especially strength training, increases muscle mass, which in turn raises the BMR. A higher BMR means more calories are burned at rest, aiding in weight management. Also in the handout, there is a simple 8-minute, 8 exercises in 8 minutes that help burn calories. And then there's a website that's listed on there for more exercises that you can do in a short period of time. Healthy eating. Balanced diet is a plus. Consuming a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help maintain a healthy weight. These foods are nutrient dense and lower in calories compared to processed foods. Portion control. Being mindful of portion sizes can prevent overeating. That's as you can see on your plate, like the different, how big of the portion you're supposed to have. Using smaller plates, measuring service, and avoiding eating directly from packages can help control calorie intake. Limiting processed foods and sugars, reducing the intake of processed foods, sugary foods, and high calorie snacks can significantly decrease calorie consumption. These foods are often high in unhealthy fats, sugars, and salts, contributing to weight gain. So, according to the World Health Organization, they recommend at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week for adults to maintain health and prevent obesity. And the dietary guidelines for Americans emphasizes the importance of a balanced diet and portion control in maintaining a healthy weight and reducing obesity risk. By incorporating regular physical activity and adopting healthy eating habits, individuals can effectively manage their weight and reduce the risk of obesity as it's associated with health complications. So, do you have your phone on you?
Yes, ma'am.
All right. Can you go on there and pull up one of those websites for me? Whichever one you choose. Are you okay? Do you need any help? Mm-hmm. Okay. And also in your handout, there is an email on there for easy recipes for healthy eating.
Okay.
Got it pulled up?
Mm-hmm.
Does it look like it's easy to use and easy to follow?
Yes, ma'am.
All right. Do you have any questions or concerns for me?
No, ma'am.
All right. Next, I'm going to give you an evaluation tool. If you would take a minute and evaluate, there's 5 questions. If you would take a minute and fill that out for you.
Do you have a pen?
I do. I'm sorry. Here you go. All right. You can do that. Thank you.
Yes, ma'am.
Thank you. And this includes my health education program presentation. And I want to say thank you for coming.
Yes, ma'am. Can I keep this?
You sure can. It's yours to keep.
Thank you.
Uh-huh.